I'm going to ask you to engage in a mindfulness practice for the next 30 seconds. So I'm going to ask you guys to relax, sit up straight in your chairs, and maintain this posture. And with your hands, you can just gently lay them in your lap. Now I'm going to ask you to close your eyes. Now I want you to direct all of your attention on the sensations of breathing. I want you to feel the air as you inhale and feel the air leave as you exhale. If you find that your attention's wandering, I want you to gently but firmly redirect your attention back to breathing. Okay, now you can open your eyes. So hopefully that felt good. So what I asked you to take part in is known as sitting meditation. And this is a simple task, but it's definitely not easy. And what this allows you to do is to just focus all of your attention on the present moment. So I like to do this whenever I feel that my mind's racing, for example, this morning before my presentation, as I'm thinking about what's going to happen before, have I practiced enough, and it just allows me to just simply live in the present moment. So in recent years, there's been a growing interest in adding mindfulness practices to reduce stress and in all sorts of interventions that we have. But you might be wondering, what exactly is mindfulness? So it's important to know that mindfulness is rooted in Buddhist traditions known as Vipassana, which is a Sanskrit term meaning gaining insight into the true reality that we're in. But in our Western context, it's been operationalized into two main components. The first being self-regulation of attention, and the second being acceptance of our current experiences without any judgment. So I'm going to be talking about the first component of mindfulness, self-regulation of attention. But before we go into that, it's important to know the two attentional processes that we use. So the first that we can have is called automatic processing. And this is involuntary, something just triggers and captures our attention. And this is fast and effortless. On the other hand, we have controlled processes. And this is when we voluntarily shift our attention towards the stimuli. And this is slow and requires more cognitive effort. So it's controlled processes that are involved in the self-regulation of attention. Now I want you to keep this in mind as I go into the different components of the self-regulation of attention. So we have sustained attention, which is voluntarily putting our focus onto one stimuli for an extended period of time. So this would be focusing on your breathing. Another aspect is attention switching, so switching your attention voluntarily between different stimuli. So this would be bringing your attention back to the present moment. And we have inhibiting elaborative processing, so not worrying about things that exist outside the current moment. So there have been preliminary research that's done that shows that mindfulness can improve these areas of attention. But there's also been other research done that says perhaps it's just non-directed attention that mindfulness helps, and that we just have enhanced and better quality of overall awareness of what's going on around us. So now with a little bit of this backstory, you might be wondering, so should we implement mindfulness? How can we implement it? What could we implement it with existing therapies that we have? And the answer is yes. So in the late 1970s, Dr. Jon Kabat-Zinn introduced a program called Mindfulness-Based Stress Reduction. And what this was aimed to do was to treat medical and physical conditions that individuals have. So the program itself is an 8-week course in which they have weekly about 2-hour meetings to talk about how we can incorporate mindfulness in our everyday activities, having small and large group discussions, and learning meditation. And outside of these weekly classes, individuals are encouraged to practice meditation for 30 to 45 minutes a day. And there's obviously been research done to see the effectiveness of this program and this intervention. So one study was done to see whether MBSR improves chronic health conditions. So they had a group of individuals who had chronic neck, back pain, headaches, migraines, and they had them complete the MBSR program 6 times a year for a 7-year period. At the end of this, they found that there were improvements in pain management, health-related quality of life, and improvement in psychological symptoms. There was another study done to see if this program can help individuals with sleep, mood, and stress. And these individuals have cancer, and sleep disturbance often is a large problem. So what they found was that it does have positive benefits, and that they see a decrease in sleep disturbance, they see an improvement in sleep quality as it's longer and more efficient, and they see an overall improvement in mood, especially in the areas of anxiety, depression, hostility, and confusion. So this is just some evidence showing how mindfulness practices can help physical symptoms. But what about any sort of psychological concerns? Can this be used alongside existing psychotherapies? And the answer is yes. So we have cognitive therapies that aim to reduce negative thoughts someone might have and promote healthier thoughts. But adding mindfulness, which is known as mindfulness-based cognitive therapy, can actually encourages the individual to view these negative thoughts and feelings that you have as just passing events, and they don't necessarily reflect reality. And this is very important, as we see with individuals who have depression, that having 3 or more depressive episodes, there's an up to an 80% chance of relapse and having another episode. But when they incorporated MBCT, they saw that there was about a 50% decrease of having another depressive episode, which is amazing. And other benefits include that this treatment is on par with using maintenance antidepressants in order to treat depression. And this is amazing because MBCT has no negative physical side effects. And overall, it just promotes a long-term well-being of individuals with depression, as there's a high adherence rate to MBCT and there's a decrease in residual symptoms. So perhaps adding mindfulness to existing psychotherapies can help individuals with depression and any other mental health concerns. So overall, mindfulness can help cultivate a deep and long-lasting feeling of inner calm. This can help anyone with any daily stresses that they have, whatever that looks like to them. And there are also apps that exist that can help you cultivate these practices of mindfulness. So I want you guys to take a deep breath in, because you're going to be okay.